When China can come up and say that influencers cannot say whatever they want to say.
You have removed 84 fibroids in one uterus, which is a Guinness record.
Yes. Everything is about today's time, is about quality of life we are going to offer to the woman. People have to understand women get exposed to the endocrine disruptive chemicals more than the men.
Oh, that's not good.
It leads to increased incidence of PCOS, endometriosis, fibroids and cancer.
You are one of the first to use robotic laparoscopic methods in gynecology in Asia Pacific.
In the a woman is to neglect herself.
So
that hit me hard. I do a lot of awareness classes to these young kids in the school. They go to internet and understand. And if the wrong information is there,
they should Google about the symptoms and not the treatment.
Symptoms, if you tell no, headache means it will tell cancer.
Exactly. How will robotics or minimally invasive surgeries help in this?
Regenerative medicine future is it can overcome the organ transplant deficiencies also.
So you have a superpower to erase anything from anyone.
In every field there is caste politics. Other outside India it is even more
more.
But then they shield it under their
They make it look. Ma'am, namaste and very, very, very warm welcome to this episode. It's a very special one indeed.
Hi Kavya, how are you? I think it's a privilege for me to be on your podcast.
Oh, that's such a warm thing to say, ma'am. But I think I have a pioneer who's just changed the landscape of this women's health in India, Padma Shri Awardee. So thank you for this opportunity that you've taken this time. Thank you, ma'am.
Pleasure is totally mine.
Yes, ma'am. So I would want to actually talk to you about everything so that this is one for all the youngsters who are seeing to become an inspiration and a lot of common things that I think would want to demyth.
Absolutely.
So let's start with that,
right,
ma'am. So I would want to ask you, ma'am, with all the experience that you have, you have enlightened India once and for all. Can women with endometriosis have natural conception? What is the best way she shall address this situation?
See, first thing is endometriosis is a locally invasive destructive disease. Mm-hmm. So instead of denial, when we still start accepting that I have it, so I want to tackle it, I want to see that I have a pain-free life or fertility life, that clarity a woman should have instead of going from one doctor to one doctor in denial. See, on an average, it is well-known fact that they change around 7 to 8 doctors before finally accepting that.
Oh my God.
So that thing first has to change.
Waiting for someone to say you don't have it.
So because of that, it becomes more destructive.
Right.
But if you first instance, when you meet a doctor and doctor says you have endometriosis, you work on it, see that with your diet, exercise and medicines to keep it under control, then go for pregnancy. People can become pregnant spontaneously.
Wonderful. Yes.
So first thing is no denial. So awareness of the disease, acceptance of the disease, working on it in a holistic way. Not just the medicines, exercises, dietary, understanding that it is a pro-estrogen phase which is worsening the disease.
Right.
So look at what sort of diet we are eating, then seek that pain-free life, because pain is an all-consuming thing which will lead to so many complications.
Right, ma'am.
It can lead to dyspareunia, dysphagia. When I say dyspareunia, we know the intercourse itself becomes difficult, because of which again pregnancy might become difficult. And locally, because of the destructive disease and the inflammatory thing which happens, if we don't take anti-inflammatory and the medication which goes, it destroys the ovary and the quality of the oocyte which comes out.
Right.
Now, if it goes on to the fallopian tube, the type of the fallopian, usually what we see, Kavya, is fallopian tubes are open in endometriosis. It is inflammation and they look edematous, but they actually function well.
Oh, yeah.
But what happens is if you, again, neglect the treatment, it can affect the fallopian tube also.
On a later
that
date.
Again leads to all the problems. So yes, we do have quality of oocyte affected. Yes, we do have the results of IVF even with women with endometriosis. Without endometriosis, definitely is going to be difficult and difference. So we need to understand without delaying. Think of the quality of oocytes. You want to freeze your oocytes, please freeze them. You want to freeze your embryos, please have that. If you want to have pregnancy.
You want them to do even much before they knowing whether they could have it or not.
Yes. That's
so
very
start
important.
This to begin with.
Because it's like I said, it's a locally invasive and destructive disease.
Right.
Any disease which is like this, like we usually tell them, it is like cancer, but not cancer. So when we talk about cancer, we never talk about cure. Right. We only talk about remissions,
presence of it and how
remissions and relapses.
Right.
The same thing we talk about when we talk about endometriosis. We can completely keep it suppressed with the medicines. When you want pregnancy, we are looking at seeing that you become pregnant.
Yes. Okay.
So you have to look at that. So instead of wasting time and later brooding, at 35 years, your age-induced biological clock is ticking and the quality of oocytes come down. Plus endometriosis-induced thing. So double the markup.
Yeah.
So why are we waiting for it?
So even before someone who's wanting to have kids, someone who think in future they might as well first freeze them and then think of marriage or think of kids.
I totally believe in the choice.
Right.
Whether she wants at 40, 35, that's her choice. But at that point of time, see,
She should be able to.
Yeah, a human being is always somebody who keeps changing their ideas. Today, I might want to do this. Maybe after 5 years, I change my ideas and everything, and maybe I want to do something else.
Yeah.
Like, as a child, I'm sure you must have also thought, I'll be a pilot, I'll be that and all.
Sure.
Now, are we a pilot?
No, we are not.
So something like that.
5 years is too long. I think it's day to day.
Day to day, we are changing in what we want to do in life. So when the woman wants to have a child, there should be a choice to her.
Right.
Then she should not regret. There's no scope of regret in today's time because this is one life. If you don't want, perfectly fine, but you did have a choice.
Yeah.
So that thing is what we should look at.
You should be able to make that choice when you have what you need.
Yes.
Right. Okay. Sure, ma'am. Second thing, many women say that they're told they need a hysterectomy, but they aren't clear why. With your minimally invasive and robotic techniques, when can a hysterectomy be avoided and when is it truly necessary?
See, first thing is I totally believe the choice should be given to the woman about what treatment they want to have. Because for every disease, there are 3-4 options. First, always when a woman comes to me with abnormal uterine bleeding, we should try medical management.
Right.
The success rate of medical management is about 40 to 50%. Yes, it might come back again. With failed medical management, that is hormonal treatment, again here one sentence I want to tell you is, people have to understand a diamond only cuts a diamond, not a knife. So hormonal imbalance is there, it is the hormonal treatment. The fear of hormones.
There is a lot of fear.
Fear, and they think that it is the same old time hormones which will lead to so many side effects. That deters them from taking the hormones.
Yes.
The second thing is we have so many minimally invasive things like Mirena, which is an intrauterine device which produces locally progesterone. The same hormone given locally so that side effects are not
And
there.
I think that lasts quite
5
some
years,
5 years.
sometimes 8 years. You can change it again. We can totally avoid hysterectomy. Third, we have TCRE, where we go in and thermal balloon ablations, where we burn the lining or we remove the lining with the current so that lining is not there, so bleeding is not there. The success rate of Mirena and the TCRE will be as high as 95 to 98%.
Lovely. Okay, ma'am.
So with these techniques, usually we avoid the hysterectomies. But only when these 3 fail and a woman is more than 40 years, or when the DNC shows some pre-malignant conditions, or it is multiple fibroids, like 20, 25 fibroids where it is there, or it is adenomyosis where the pain, all-consuming
Quality
pain
of
is
life
there.
is there.
Only there we should look at the. Otherwise, for everything, including fibroids, we have myomectomy. If it's a bleeding, we have Mirena. See, and for a cervicitis, I think we should stop thinking of hysterectomy. You have medical management, we have cryocautery, electrocautery, then we have conization. So cervix infections should never be a reason unless it is malignant or pre-malignant.
Right.
So 90% of the indications now can be completely treated
And
with
they're all
minimally
daycare.
invasive.
They're all daycare.
Daycare.
Minimally invasive, probably come today, go
That's
this
it.
evening, come today, go tomorrow max.
Or even the same day. It is like 5-10 minutes. If it's Mirena, it's a 5-minute
5-minute procedure.
So it's like that. We should, but the options should be given. So I believe every doctor should come to in the OP card, should give the diagnosis, what is she suffering with, then the options she has, medical, Mirena, TCRE and this. Give her a chance to read about them. This is something I want to make it a point on your podcast, because when I tell them, please Google and come back, they get offended. They think that we came to the doctor, we paid her, she should explain, why is she telling me to Google? But what I want to tell people is, the knowledge is very important about your disease, not what we tell. You should get the knowledge from the unbiased platforms. And then come back. We are here to discuss with you tomorrow again. We don't charge again. So come back and say, madam, these are the options. Which can I take? Then it is easy. It is easy for me to start a conversation from LMNOP rather than ABCD when you don't know anything. So they should Google about their disease, patient knowledge, not doctor's knowledge.
I think they should Google about the symptoms and not the treatment. So treatment part, they should
symptoms is even more dangerous, Dr. Kavya. They should not Google about symptoms.
Ma'am,
the diagnosis we give, that one
that is what they should. That's what
that's
meaning.
it. Not treatment or anything.
Not treatment, yes.
Only when we give it, like if I say there is PCOS, Google about PCOS so that what happens if they are not treated.
Correct.
So they understand the importance of treatment.
Why the treatment is needed. Right.
That's what. Symptoms, if you tell, no, headache means it will tell cancer.
Exactly.
Please
I don't
throw.
want them to do, because if they
Symptom
say
thing,
fever, it can also be cancer, it can also be HIV,
So no
it can be
symptom
anything.
Googling.
Yes.
It's a diagnosis Googling.
Correct.
Then we discuss about options they have.
Yes.
So people should not get offended when we say Google it. But Google the right thing the right way. Right information, right to information, and the correct information in the correct platform is very important.
So that you know what you're going through, so that you know that this is the right thing
Options.
that you need.
And your doctor and you can have a correct
Conversation. Yeah, sure.
So it's always, conversation and comprehension. If the other person is not understanding what you're doing, that is not called conversation. It is like
just
unilateral,
one way.
one debate thing going
Correct.
on. Right?
True, ma'am. Yeah, I think that makes a lot of sense. So you have pioneered in ovarian and endometrial rejuvenation,
Right.
using stem cells and PRP.
Absolutely.
So for women who have been told you have got low ovarian reserve or a very thin lining,
Right.
how much can this help, and what should they actually realistically expect out of
Right.
this?
So when we started doing this, it was all whether it will work, will not work. Is it a fact or is it a myth? Again, the same thing. Now, when we understand the science of regenerative medicine, this is science, not maths. So you cannot say 1 + 1 is 2. We don't know whom it will work, whom it will not work, and we will not know who will be benefiting from it and all. But we did know over so many years of using it, or more than decade, that there are few factors where we tell them it might work, it might not work. Age is one factor.
Right.
As the age is more, it might not work.
And what do you
much.
mean by more, ma'am?
It's 45, 43, they come across. More than 40, we will put it as.
Okay.
See, regular patients 35 and all 30 above also, the reserve might be low. But when above 40, the results are really good in some patients. But 45 and above, we do see that results might not be as good as we want them to have in 25, 30 years.
Right.
Second, if the ovaries are calcified, lot of calcification, results are not
Do you
so
see
good.
calcified ovaries earlier
Yes.
also?
Nowadays
Oh.
we are seeing because of pollution. But rest of the patients, and in endometrium we see tuberculosis has hit them.
Yeah.
The fibrosis will not be there. But rest of the it is good. Why is it good? Because we are not, first thing I want to tell people that we are doctors, not gods. Don't make us gods. We are trying to help you. Now what we are doing in the ovaries, Kavya, is that we are injecting your own stem cells and PRP, which act in dual thing. One, it changes the environment there, so it is anti-inflammatory and it is anti-apoptotic. It will
Right.
not allow the cells
Cells
to
to
die.
die.
And then we are also creating the neoangiogenesis. These are
Right.
three main properties. So you're improving the blood supply, we are stopping the inflammation, and we are changing the environment so that
So they don't die.
the cells take a good breath. And then PRPs will cause growth factors, which will help the hidden oocytes to come out. So we are not creating
any
anything.
new thing
God
there.
is the only body who is creating. See, I'm not an atheist or priest or anything. I believe in God. So if anybody says being a science person, why is she telling that? I'm not here to justify, nor am I here to
Explain,
negate.
yeah.
For me, there is some superior force who has created this.
Right.
That is something which we are not meddling. We are just making the environment healthy so that can breathe and come out.
That can do its duty.
Yes.
Right.
That is first thing without. So people who have FSH of 104, 105 come down to 7, 8, spontaneously become pregnant. That is
Wow.
the best part.
Yes.
Second, with endometrium, we do see that in Asherman's, where we call, where the uterus gets stuck inside, or tuberculosis of thing, these are little lesser effect, but results are really good. When I say good, when we give 0% chance versus 33% pregnancy take home rate, that
Wow.
is huge.
Oh, that's huge.
Huge.
Oh, that's
0
huge.
versus
With
33.
hardly nothing
Yes.
but just injecting your
Yes,
own stem cells into
and
you.
everything. And this is what I say. From 0% to 33%, everybody should be trying it.
Yeah, they
That
should
is
be
what-
trying.
With endometrium, it is even more better
I see.
than the ovary.
Okay, okay, ma'am. Then you have removed 84 fibroids in one uterus, which is a Guinness record,
Yes.
and performed pioneering surgeries for an average woman. Once the fibroids are removed via laparoscopy or robotic way, what does the life look like? What do you say, like the recovery is?
Yeah. When we look at fibroids, we do have to understand that it is there in almost, like in different studies, 20% to 80% of women. So just because of they are there, we are not treating. We are not treating papers. We have to treat patients. So only symptomatic fibroids, whether they are coming in the way of pregnancy or whether they are coming in the quality of life in the form of bleeding or pain. That's when or big mass like 9th month pregnancy, that's when we intervene into it. So quality of life depends on the symptoms she's been having. If it is submucous, Bleeding is
If
the
it's
main
incidental,
thing.
you don't do anything.
We don't do anything unless it is there. Most of the women around perimenopause come with an incidental finding and they're worried about 1 centimeter fibroid. So we need to look at size of the fibroid, location of the fibroid, and the symptoms, whether it is pressure symptoms, whether it is bleeding, whether it is sudden increase in size, everything. So if it is incidental, we just tell them to monitor.
Right.
Every 3 months scan or every 6 months scan. If it's suddenly increasing, it's
Then-
a point of concern. Otherwise, should not be done anything.
So when you do, how is it like for them in future for fertility?
Fantastic. The pregnancy rates are as high as 80 to 90%.
And what do you talk about recurrence, ma'am?
See, recurrence, there are two things here. One, did we remove every fibroid before is a point which we have to tell. So there is always for any disease, genetics and epigenetics. So genetics is what is the chance that you might get the disease. But just because it is there doesn't mean you will get the disease.
Get
It
it.
is the epigenetics in the form of, again, pollution, where endocrine disrupting chemicals work, or it can be in the form of what you eat, or how stressful your life is, not doing exercise, being little obese, where estrogen content is more. All these make a factor in formation of fibroids. Now, if you have a tendency to form fibroid, you can still have it, but
Right.
it doesn't become overnight a fibroid and bigger in size.
So surveillance will help.
Yes. And second thing I always tell them is what we have removed will not come back. But a new thing comes, we cannot tell that. Nobody can predict.
It does
We are
not mean that it was not removed earlier.
So that is why we repeat a scan after 3 months to show them that it is gone. They can say that if there are many fibroids, 20, something like that, we cannot remove every small thing, right? So we might remove 14, 15 and 4, 5 small things can still be
Stay
left
back.
over. So they should remember that. That if when it grows, people might think it is recurred. It might be a remnant fibroid.
Right,
So we should
right.
know the difference between remnant
Remnant.
fibroid, recurrent fibroid, and sometimes people do take some medical management which hides the fibroid for some days. Once you stop the medical, again it
might
come
show
back.
up.
So is it real recurrence or not is what is important.
So
but if the purpose is solved, I think people should not be worried. If the bleeding is the thing and it is well under control, perfect.
I think this is very important when you go to the doctor who've gotten your surgery done. Please go back to the same doctor
Same
because they know
surgeon.
what they did on you and they know exactly how you need to follow
It up.
Yeah.
Absolutely.
Yeah,
And
I think-
lifestyle goes a long way with
Right.
fibroid and endometriosis.
Right, ma'am. Okay. So when a woman presents with a complex mix, say like a massive fibroid, prolapse, infertility, prior failed surgeries, how will robotics or minimally invasive surgeries help in this, plus regenerative therapies?
Everything is about today's time, is about quality of life we are going to offer to the woman. And there is nothing to beat except minimally invasive surgery, whether it is robotic or laparoscopy.
Right.
Today's nuclear family don't have time for so many things. Olden days, anybody undergoing surgery, people used to come from village, stay
Village.
there for 2-3 months and go. Who has that sort of a time? And your loss of work, your pay loss,
Yeah, loss of
and
pay.
the quality of life which is going to affect, and the complication rates of infection or hernia, they're all gone.
Yeah.
Minimally invasive surgery, we can look at two things. One, benefits to the patient, benefits to the surgeon. Benefits to the patients are humongous. There is something which we need to understand. They can get the surgery done morning, afternoon, you're up working. Tomorrow you can start
Go
cooking
back.
yourself.
Right.
Yes, there is abstinence which we advise to major surgeries for 6 weeks, but rest of the things, you can go back to the job within 48 hours. You don't have loss of pay. We can do whatever you want. Vigorous exercises we tell them to avoid for 6 weeks. Rest of the things they can
Like
do.
the weights.
Whether it is prolapse, whether it is everything can be done robotically. And the point is with the robotics, there is the precision is so many times, magnification is 10 times,
10 times
than
more.
the laparoscopy. Infection rates are negligible, and pain score.
Oh, yeah.
Telling you for patients, the pain score compared to open and lap, it is if it is 0 to 90% benefit.
This is
lap and this thing is
100%.
almost 100%.
Yes.
Zero pain score when it comes to robotic. So that is something people have to understand. Saying all this, I just want to make one point very clear to everybody. When we talk about lifestyle, when we talk about environmental thing, people have to understand women get exposed to the endocrine disruptive chemicals more than the men.
I see.
Why do you think so? You have. See, no, it is because of sanitary napkins. Sanitary napkins are somebody during the time when it is the most fragile moment where endometrium is shedding, where it is ready for, any infection to have left. You are having sanitary napkins which have plastics
Plastic.
inside them. So if you have a use sanitary napkins with plastics, you are directly getting exposed to endocrine disrupting chemicals nearer to the reproductive organs. It leads to increased incidence of PCOS, endometriosis, fibroids, and cancers.
Right.
So please avoid using sanitary napkins which have plastics. Please go to menstrual cups or organic sanitary napkins or even period panties
Or reusable,
anything
yeah.
which is organic.
Yeah, okay, ma'am. So, you are one of the first to use robotic laparoscopic methods in gynecology in Asia Pacific. For a patient deciding between open, lap, or robotic, how do you explain the difference in risk, cost, and recovery? Say, like in Telugu, if you would want to
తెలుగు
mention.
అంటే ఇప్పుడు ఏంటంటే ఇప్పుడు ఓపెన్ సర్జరీ అయితే డెఫినెట్గా ఈ రోజులో ఎవరు ఆప్ట్ చేయకూడదు. ఎంత అవేర్నెస్ అవసరమో అంటే మినిమల్లీ ఇన్వేజివ్ సర్జరీకే ఆప్ట్ చేయాలి, అంటే లాప్రోస్కోపీ అండ్ రోబోటిక్. ఎనీథింగ్ విచ్ కెన్ బి డన్ ఇన్ ఓపెన్ కెన్ బి డన్ లాప్రోస్కోపీకి. అది గుర్తుపెట్టుకోవాలి. ఇంత పెద్ద యూట్రస్ ఉంది చేయలేము అంటే
Unless it's a surgeon's decision to break through.
సో ఇట్ డిపెండ్స్ ఆన్ ద
Surgeon.
తనకి దేంట్లో ఎక్స్పర్టీస్ ఉందో దాన్ని బట్టి చేస్తారు అంతే. అదర్వైజ్ పేషెంట్ వైజ్ చాయిస్ ఇస్తే మాత్రం లాప్రోస్కోపీ లేకపోతే మనం దీనికి వెళ్ళాలి, ఏది రోబోటిక్ వెళ్ళాలి. నో ద డిఫరెన్స్ బిట్వీన్ రోబో అండ్ దిస్ థింగ్ ఫర్ పేషెంట్కి ఐ సెడ్ నో, ఇట్ ఈస్ లైక్ పెయిన్ స్కోర్ ఇస్ 0.
They can go back.
And infection rates are negligible. And మనము లేసీ ప్రెసిషన్ ఆఫ్ ద సర్జరీ, మన వాస్కులారిటీ కానీ మనకి అంతే లేటరల్ థర్మల్ డ్యామేజ్ కానీ అవన్నీ చాలా తక్కువ. సో రోబోటిక్ ఇప్పుడు నేను చెప్పాను ఆల్రెడీ 0 ఉంటే కనుక మనకు ఓపెన్ సర్జరీస్, మనకి లాప్రోస్కోపీ 90-92 అనుకుంటే రోబోటిక్స్ 98 to 100. సో అంత డిఫరెన్స్ ఉంటుంది పేషెంట్ అవుట్కమ్స్లో. సర్జన్కి చూసుకుంటే మాత్రం 100% రోబోటిక్ ఈస్ ద బెస్ట్. Then comes laparoscopy. Ergonomic damage is quite common with manaki idi. So now దేశంలో డాక్టర్ ఆల్సో షుడ్ టేక్ కేర్ ఆఫ్ హిమ్సెల్ఫ్. ఇఫ్ ఈస్ అ రియల్లీ గుడ్ డాక్టర్, మనం ఎక్కువ మందికి మనం హెల్ప్ చేయాలి అంటే మనం బాగుంటేనే వేరే వాళ్ళకి హెల్ప్ చేయగలం. మనం వి సీ దట్ ఫ్లైట్ యాడ్ కదా, ముందు మనం ఆక్సిజన్ పెట్టుకుని అప్పుడే మీ బ్రెయిన్ పని చేస్తుంది, అప్పుడు మనం వేరే వాళ్ళకి హెల్ప్. సో మనం బాగుంటే వేరే వాళ్ళు బాగుంటారు. కాబట్టి రోబోటిక్లో మనం కూర్చుని చేయొచ్చు. ట్రెమర్ ఫిల్టరేషన్ ఉంటుంది, అంటే ఒక 78 years ఎక్స్పీరియన్స్ డాక్టర్ అయినా కూడా వాళ్ళకి ఏమైనా ట్రెమర్స్ వచ్చినా ఫిల్టర్ అయిపోతుంది. సో ప్రిసైజ్ సర్జరీ విత్ లీస్ట్ కాంప్లికేషన్స్ అంటే మాత్రం రోబోటిక్.
Right. And would you want to talk something about the cost difference, ma'am?
Yes, then definitely anything we need to understand. Naaku success ki any doctors ki cheppalante kuda there is a 6-point mantra for me. Okay, ఫస్ట్ ఈజ్ టెక్నిక్. మనం టెక్నిక్ బాగుంటే మిగతావన్నీ లేకపోయినా మనకి చాలా ఇంపార్టెంట్. సెకండ్ ఈజ్ టెక్నాలజీ కీప్స్ కమింగ్. ఇప్పుడు ఏఐ గురించి మాట్లాడతాం మనం. సో అట్లానే టెక్నాలజీ మనకి ఇప్పుడు రోబోటిక్ కానీ మినిమల్ ఇన్వేసివ్ సర్జరీలో లాప్రోస్కోపీ కానీ వస్తున్న కొద్దీ మనం అడాప్ట్ చేసుకుని ముందుకెళ్ళాలి. ఎందుకంటే టెక్నాలజీ కమ్స్ ఫర్ ద బెనిఫిట్ ఆఫ్ ద పేషెంట్. ఒక పేషెంట్కి మంచిగా లేని టెక్నాలజీ నిలవదు. సో అది ఉన్నప్పుడు మనం నేర్చుకుని పోవాలి. థర్డ్ వన్ వుడ్ బి ప్రాపర్ ట్రైనింగ్. మనం కొత్తది వస్తే ఎక్స్పెరిమెంట్ చేయకూడదు పేషెంట్ మీద. మనం చక్కగా నేర్చుకుని సర్టిఫికేషన్ తీసుకుని లైసెన్సెస్ తీసుకుని మాత్రమే చేయాలి. అది ఇంపార్టెంట్. ఫోర్త్ వర్డ్ వుడ్ బి ద టీమ్ బిల్డింగ్. మనం ఏది కూడా టెక్నాలజీ పెరిగే కొద్దీ ఒక్క మనిషి నేనే చేస్తానంటే కుదరదు. ఒక టీమ్ ఆర్ ట్రైన్డ్ రికరెంట్. చూడు, ఒకటి గుర్తుపెట్టుకోవాలి, మాస్టరీ ఇస్ నథింగ్ బట్ ఎ హ్యాబిట్. సబ్కాన్షియస్గా రికరెంట్గా మనం చేస్తూ ఉంటే అది అలా అయిపోతుంది. మనం ఒక రోజు మనకి మంచిగా మూడ్లో లేకపోయినా అది ఆటోమేటిక్గా మసిల్ మెమరీలో వెళ్ళిపోతుంది. అట్లా మనం మాస్టరీ చేయగలగాలి. అది మనకి ఇంపార్టెంట్. అండ్ ద ఫిఫ్త్ పాయింట్ వుడ్ బి టీచింగ్. మనతో ఏది ఆగకూడదు. మనకి ఏదైనా మంచి అనుకుంటే మన నెక్స్ట్ జనరేషన్ షుడ్ బి. ఫైనలీ ఇట్ ఈస్ అ టెంపరమెంట్ విచ్ ఈస్ వెరీ ఇంపార్టెంట్. మన టెంపరమెంట్ బట్టే మనకు అవుట్కమ్స్ అన్నీ కూడా ఉంటాయి. సో దిస్ ఈస్ సంథింగ్ వెన్ ఐ డూ దట్. సో వెన్ ఐ సే అబౌట్ టెక్నాలజీ, ఐ టెల్ దెమ్ టెక్నాలజీ డజంట్ కమ్ విత్ ఇది. హ్యూమన్ బీయింగ్ ఇస్ వేస్ట్. మనకి చాలా చీపర్ కమోడిటీ మనం. బట్ టెక్నాలజీ ఈజ్ వెరీ ఎక్స్పెన్సివ్. సో వెన్ ఎక్స్పెన్సివ్ ఇట్స్ గోయింగ్ టు యాడ్ టు ద కాస్ట్. బట్ in today's time, if you have money and you want the best for your health, I'm telling you that. ఎందుకంటే నేను ఇప్పుడే చెప్పా, ఒక ఉమెన్ బాగుంటే ఫ్యామిలీ బాగుంటుంది. ఒక ఉమెన్ హెల్దీగా ఉంటే ఫ్యామిలీలో అందరూ హెల్దీగా ఉంటారు. ఇంతకుముందు రోజుల్లో ఉమెన్ ఈజ్ టు నెగ్లెక్ట్ హర్ సెల్ఫ్. లాస్ట్లో తింటాను, మిగిలితే తింటాను రోజుల నుంచి. ఇప్పుడు పీపుల్ హ్యావ్ అండర్స్టూడ్ ద ఇంపార్టెన్స్ ఆఫ్ ఉమెన్స్ హెల్త్.
రైట్.
గవర్నమెంట్ దగ్గర నుంచి అందరూ మాట్లాడుతున్నాం మనం. అది రియాలిటీ చేయాలి అంటే ఇఫ్ మనీ ఈజ్ నాట్ ఎన్ ఇష్యూ, బికాస్ అడిషనల్ 1.5 lakh 2 lakhs kuda avutundi depending on the number hours of surgery and all that. Definitely robotic is the best.
Okay, sure, ma'am. So can we have a future where regenerative medicine can even help overcome extreme cases of fibroid, endometriosis?
Definitely. Not only that, regenerative medicine future is it can overcome the organ transplant deficiencies also. So when we look at regenerative medicine, we look at 3 things, Amma. One is regeneration, one is rejuvenation, One is again mana complete organ replacement.
Yeah.
So it's 3 R's. Triple R has always been good for us. So it is replacement,
Oscar
regeneration.
winning.
అందుకే కదా మన ఇది ఆస్కర్ విన్నింగ్ అంటాం అంతే. సో రిజనరేషన్, రిజువినేషన్ అండ్ రిప్లేస్మెంట్. రిప్లేస్మెంట్ అంటే ఆర్గన్ రిప్లేస్మెంట్. సో వెన్ వీ కెన్ హ్యావ్ ఎ 3D ప్రింటింగ్ ఆఫ్ దట్, 3D ప్రింటింగ్ ఆఫ్ దిస్, హెచ్ఐ టైపింగ్, మనం యాంటీబాడీ అది రిజెక్ట్ అవ్వకుండా మందులు వాడటం అవన్నీ కూడా అవసరం రాకూడదు.
Correct.
So it's not very far away. There are
Right.
lot of experimenting happening with tracheal, the bladder.
Even at our liver, for liver cirrhosis also, there are a lot of studies that are happening.
అది రియాలిటీ అవ్వడానికి ఎక్కువ రోజులు పట్టదు. ఇన్ని రోజులు ఎందుకు అవుతుందంటే ఇప్పుడు మనకి మన టోటిపోటెంట్ సెల్స్ రావడం గురించి మనం వెయిటింగ్. జపాన్ హ్యాస్ ద టెక్నాలజీ. వన్స్ ఇట్ స్టార్ట్స్ కమింగ్ ఆఫ్, ఇట్ ఈస్ ఇండ్యూస్డ్ ప్లూరిపోటెంట్ సెల్స్ వచ్చేసాయి అంటే మనకి ఇవన్నీ టోటిపోటెంటే. ప్లూరిపోటెంట్ అంటే మనకి ఇక్కడి నుంచి కూడా ఒక సెల్ తీసుకుని దాన్ని మనం బకల్ మ్యూకస్ చేయగలగాలి. ఇప్పుడు మనకి స్టెమ్ సెల్ లైన్స్ చూస్తాం మనం. అప్పుడు ఏమవుతుందంటే మన స్టెమ్ సెల్ లైన్ అవసరం లేదు. ఏ సెల్ నుంచి అయినా మనం కావాల్సిన అది నడుస్తుంది. ఇప్పుడు జీనోమ్ థెరపీలు నడుస్తున్నాయి. ఇవన్నీ రియాలిటీ అయినప్పుడు ఎస్ ఇట్ కమ్స్ విత్ ఎ కాస్ట్ విచ్ ఐఎమ్ నాట్ సేయింగ్ నో, బట్ దెన్ the option again is there for the human being.
Yes.
So regenerative medicine is it's a science, it's a game changer, but started in so many things like neurology, like orthopedics, and in gynecology is making waves. Rest of the departments also is sure going to make.
Yeah, sure, ma'am. So now a fun round.
Yeah, absolutely. I love doing this.
It's a very, very light-hearted round. So you have a superpower to erase anything from anyone.
Okay.
Tell us what you would wish to erase from the following. You can answer it in a very fun way or something that you really want to. From young men.
Young men, they think that they know everything in the world. So I think they should understand that అన్నీ అందరికీ తెలియదు. ఆ ఏజ్లో మనము ఇమ్యూన్ అనుకుంటాం. కాదు, వీఆర్ యాజ్ ఫ్రెజైల్ యాజ్ ఉమెన్ ఈజ్, యాజ్ ఫ్రెజైల్ ఇస్ ఎ థింగ్ ఎమోషనలీ అండ్ ఫిజికలీ. డోంట్ హ్యావ్ టు షో ఎ ఫాల్స్ ఫేస్ దట్ వీఆర్ ద బెస్ట్.
Yeah, you don't have to shield yourself.
Shield yourself. So be yourself.
Yes. Second, from young woman.
Young woman, you don't have to be a superwoman. You don't have to prove to anybody your worth. You know what you are and be like that.
Okay. From people above 50 years of age, what would you want to erase?
It's not a time about menopause. It is me, no pause. So remember that. There's nothing to stop you. Please go ahead.
Wow, that's nice, ma'am. From present education system.
From present education system, the thing of butticotifying to understanding.
Okay. So you say a very practical approach.
I somehow like Waldorf schools concept, but parents get very
annoyed. They don't like the concept of no first, no second.
No first, no second, no exams. I don't know what my daughter knows, what my son knows. Yeah, I think
that should be changed.
Parents should change, then only education system
will change. From present medical students.
From present medical students, I think they are very, 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 very. In today's time, they want they want very easy-going subject in the sense that
they're very casual also.
We all used to think of we want to be a surgeon, we want to be today we want. I'm not belittling anything. We want 9 to 5 job. We want to have holidays. But I don't understand, where is your passion gone? You took medicine chose the subject. Subject did not choose you.
Right.
And you had a purpose of life. What happened to the purpose of life?
Correct.
So I think, I don't know. It's not me which hospital that they have to ask themselves.
Right, ma'am. From hospitals, what would you want to erase?
Hospital, more of commercialism should come down.
Yeah. From medical fraternity.
Medical fraternity, please understand and respect your colleagues and stop talking negative about anybody.
Anyone's treatment, anyone's
stop. Because we need, like I told you, it's science, it's not match. There's always options. So when the option is there, you chose something, the other person might choose something.
Right.
The same option can give different results to different people.
Right.
Respect that. Respect your colleagues.
Right. From India.
From India, I love India, right? So do you want to erase something? Yeah, I do want to erase 2 things. I think one is the caste politics.
Yeah. Caste-based politics.
And patriarchism.
Yeah. I think,
it's very difficult.
Very difficult.
But yes, caste politics are here. And in every field there is caste politics.
Right.
And definitely patriarchism is here.
It's here to stay,
everywhere.
I believe.
We cannot change it.
From the world.
Same patriarchism in the world. Other outside India, it is even more there. But then they shield it under.
They make it look like it's not there.
That's one thing. Yeah, caste politics might not be there, but patriarchism is there everywhere.
Right. From yourself, ma'am.
From myself, my temper. Something I feel that when something is going wrong with the patient, I get very angry with anybody giving wrong treatment.
Right.
I give it off. I don't carry it, but I give it off.
Okay.
I keep telling me I should not be getting angry. I should not be getting angry. But it's a momentary thing, knee-jerk reaction. I shout at people. That is something I need to do.
Okay, ma'am. So now, last and final, from the internet.
Internet, I think this yellow journalism should go. There should be a thing to say what is right, what is wrong. So if you ask the same question in the internet, you have so many papers saying negative about it, so many papers saying. So the people are all confused. So somebody has to say that the right information to come. So like
there should be a filter.
And like we were just discussing with my friends outside that when China can come up and say that influencers cannot say whatever they want to say just because they have a right to say and everything. No, they should have a license to say that particular job. Every Tom, Dick and Harry cannot talk about medicine and everything. Every Tom, Dick and Harry cannot talk about education system or anything. So they should have a license or a degree about saying that. So I think that should say the clarity. See, why I'm saying this, I will tell you. I do a lot of awareness classes to these young kids in the school, 5th, 6th, 7th classes and all.
Right now.
They are very gullible age. They succumb to so many things and they're so...
They're like sponge.
They're sponge. And they're so scared to talk to their parents, because they feel that they're scared to talk to the teachers. So only thing they think is talking to the friends who have the same knowledge as them. So they go to internet and understand. And if the wrong information is there, then you know what the outcomes can be.
It's the same thing that rotates and comes back, and I don't think they get the...
There's so many wrong things which are there. They can
sadly
get exposed
they are. So ma'am, the next one is a rapid fire round. So 5 seconds lo ma'am, you should answer
నేను ఎలాగో 5 seconds లో చెప్తాను.
చెప్పకపోయినా ఒకటి కన్నా ఎక్కువ చెప్పినా మీరు ఒక షాట్ తీసుకోవాలి. అండ్ దీస్ షాట్స్ ఆర్ బీట్రూట్ జింజర్ షాట్స్.
ఓ మై గాడ్, ఇలాంటి ఎంత టూ హెల్తీ, సంథింగ్ టూ డేంజరస్ ఫర్ మీ.
ర్యాపిడ్ ఫైర్ రౌండ్ మ్యామ్. సో మీరు స్టాండప్ కామెడియన్ అయ్యుంటే వాట్ ఈస్ దట్ వన్ జోక్ దట్ యూ వుడ్ వాంట్ టు క్రాక్ అబౌట్?
Taboos behind menstrual period.
Okay. Second, you are very disciplined, very planned. Is there any favorite food that you challenge even your discipline?
I think gulab jamun.
Okay. What is the weirdest compliment you have ever received?
Oh, I've never seen you having any angerness. I'm like, I'm known for temper.
Okay. So food is the way to the heart antar kada. Is there any food, dessert that if someone makes and serves you, it can make you forgive them?
I think that sabudana khichdi is something which I love. I don't know how to make. So if somebody makes,
I will send it across, ma'am.
Thank you.
Is there any one conspiracy theory that you almost believe in? Like aliens, cults?
UFO is what I was about to tell you. It's for the child, yes. UFO is something I used to always believe in.
Okay, still believe?
No.
Okay. Is there a trait that you don't want to see in humans anymore?
Jealousy.
Yeah. Okay. One medical myth you wish the internet would just delete forever?
Medical myth that menstrual blood is a impure blood.
Yeah. One medical related thought that you think is high time that people have it?
That endocrine disrupting chemicals are real and it leads to destruction of women and womanhood.
Oh, okay. Is there one symptom you look for in patients that instantly make you go like, oh, that's not good?
Pain during periods.
I see. And how severe?
Congestive dysmenorrhea, when I say that. There are types of pain. One is it comes on first day and then goes off.
Right.
That's fine. That is manageable. But a pain which comes 4-5 days before, lasts throughout the period, means 15 days of your life, it is like congestion of Hyderabad roads. It is congestive dysmenorrhea. That means there is pathology. That's not
that
good.
should be looked into. What's the most creative excuse you have heard from a patient for skipping a treatment or a medication?
Oh, that is like, we just changed our house.
Yeah.
We lost all our papers and we were thinking of coming. But
Okay. Mothers or patients or request doctors, ila cheyandi, ala cheyandi ani. What is the weirdest request you have ever received, ma'am?
Will be most of the time that manaki younger vachita kada PCOS, they will keep on asking us PCOS gurinchi cheppetappudu, దాని గురించి చెప్పేటప్పుడు ఎక్సర్సైజ్ అస్సలు మాట వినదండి, అస్సలు తినదండి, అయినా లావ్ అయిపోతుందండి, అండ్ ప్లీజ్ టెల్ హర్ ఎక్సర్సైజ్ చేయటం లేదు, ఇవే ఎందుకంటే ఇట్ హాస్ ఇంక్రీజ్డ్ కదా, PCOS ఇస్ ఇంక్రీజ్డ్. సో దాని గురించే వియర్డెస్ట్ రిక్వెస్ట్ వస్తుంటాయి. మెమరీ లాస్ అంటారు, డాన్స్ చేయదంటారు, అంటే ఎనీథింగ్, ఎక్సర్సైజ్ చేయదంటారు, సరిగ్గా తినదంటారు, ఏం తినట్లేదంటారు, ఈ ప్రీ మెన్స్ట్రువల్ సిండ్రోమ్లో she's shouting at me antaru. All these things.
All that. Okay. What is the one favorite book that you would like to read or share?
Arthur Haley's all books are my favorite.
Okay, ma'am. Do you have any favorite song?
I have so many favorites. So how can I say? Because for me, Atif Aslam is my all-time favorite.
Okay.
Kuch
Do you want to
Is
hum
Tarah-
something?
Kuch Is Tarah is my favorite song.
Okay. Okay, lovely.
You sing, I will join
No, you can sing, ma'am. We'll join.
You join, I will. You sing, I will sing. Say,
Atif Aslam.
any song. Not necessarily Atif
Oh,
Aslam.
I think I know Rad Fateh Ali's, he's also good.
He's like too much of singing. Yeah, that much though we don't know how to sing. He's
ma'am, you
too
can
good
start.
again.
Yeah,
But then in Kaliyug ka wo jo gana hai na, that is very good, no? Aaj Fateh Ali Khan's that.
I was thinking you were saying Gulabi aankhein jo teri dekhi na ye dil ho gaya संभालो मुझको ओ मेरे यारों
संभलना मुश्किल हो गया. That we like ये fellow Zubin ka.
Zubin,
Nautiyal ka.
Yeah. If you are prime minister for a day,
Okay.
ఇండియాలో మ్యాండేటరీగా ఫాలో అవ్వాలి అని ఏం ఇంక్లూడ్ చేస్తారు, ఏ తీసేస్తారు?
See, mandate గా follow అవ్వాల్సింది మన rules of the traffic rules.
Oh, yeah.
That is the main
I
thing.
see so many of my friends who come back from there don't drive.
అందుకే
From the
భయం
US
వేస్తుంది
and-
అందరికి. ఎవరు ఎక్కడి నుంచి రైట్ నుంచి వస్తున్నారు, లెఫ్ట్ నుంచి వస్తున్నారు. ఏది తీసేస్తారు అంటే ఐ థింక్ రిజర్వేషన్స్. ఇట్స్ వెరీ డిఫికల్ట్, బట్ దెన్ పాలిటిక్స్లో అది అవసరం.
Yeah.
బట్ ఫర్ మీ
Yeah. Okay.
ఓవర్ అయిపోయింది అని అంటే
I
ఆల్మోస్ట్
think
70 years అయిపోయింది కదా మనకి ఇండిపెండెన్స్ వచ్చి. మేబీ ఐఎమ్ రాంగ్, ఐ డోంట్ నో.
Yeah.
దట్స్ మై ఒపీనియన్స్. బీయింగ్ ఇన్ ఎ సిటీ, విలేజెస్లో సిచ్యువేషన్ ఎలా ఉందో మనకు
తెలీదు.
తెలీదు. సో హూ ఆర్ వీ టు బీ జడ్జ్మెంటల్ అబౌట్ ఇట్. బట్ ఐ ఫీల్ 70 yearsలో అందా యూటిలైజ్ అయింది కాబట్టి అని.
Now that it's aware that people have almost something that is equal.
2 generations ఆర్ ఓవర్ కదమ్మా.
Yeah.
సో 2 generations అయ్యాయి అంటే రిజర్వేషన్స్ని యాప్ట్గా తీసుకెళ్ళగలిగి ఉండాలి ఈ
Yeah,
పార్టీకి.
yeah.
సో అంత ఇవ్వకపోయినా తగ్గటం అనేది తగ్గించాలి, ప్లస్ ట్రాఫిక్ని పాటించాలి. ఈ రెండు చాలా ఇంపార్టెంట్.
Okay, ma'am. Last and final, share one lesson you've learned from your life.
I think what I have learned from my life is from my daughter only. That is something which she said, I expect, నేను చెప్తున్నది వేరే వాళ్ళు కూడా నా లెవెల్కి వచ్చి అర్థం చేసుకోవాలి అని. Then she made me understand communication is different, comprehension is different. You are not waiting for the other person to understand. So when you put a message, did they understand is something which you are not understanding. So that hit me hard, and then that's the reason. After that only I started telling patients, Google and come back.
Oh, I see. Okay.
That's what it is.
Oh, lovely.
See,
ma'am.
I did not have to
I
take
was just
any
about
shot.
to say, but these are healthy. You could have one.
I hope so, but I'm really skeptical about all these things.
Sure,
Anyway.
ma'am. Thank you so much for your
Thank
time.
you, Kavya.
It was pleasure.
Yeah.
And as everyone say, you're all our favorite.
Yeah, thank you.
Thank you for
Thank you for
us
having
today.
me on your platform.
No, it's a pleasure,
Thank
ma'am.
you,
Thank
everybody.
you.
Bye.
Bye, ma'am.